Happy Monday, MB HomeCare. I'm Steve, and I am the Executive Director here at MB HomeCare. And on behalf of Bev Francis, our Clinical Director, and everyone else on the management team, I wanted to give you a brief update on our MB's response to the COVID-19 outbreak and some things that we can do together to prevent this thing from spreading. So I'm going to start off with just a few notes of concern and points to make from our clinical director, Bev Francis. Um, so this is a interesting time in home care, and your role as the caregiver for our clients, which are all very vulnerable, plays a key part in keeping these folks safe. And I just want you to know that you all out there are the front line against this, and we are very confident that you can handle this responsibility. And we are going to be there with you the entire time, and we will help and we will guide and we will get through this together. And again, just I want you to realize, and I hope your families realize, the key part that you all play in this, and how important you are in times like this. There was a few key words that jumped out to me that I was reading the other day, and these are things that we look for in our hiring process, and these qualities really come in to play in a crisis like this, and to be able to stay calm and rely on your training, and really be there for the folks that you deal with on a daily basis. And the first one is compassion, and you all possess that. That's why you're here with us at MB HomeCare. That's one of our big what we really strive to do on a daily basis is show compassion to all of our clients and our colleagues, and that really comes to play in times like these, because when you're dealing with vulnerable adults who really can be somewhat helpless at times, and they really rely on the folks that are helping them out. Um, just showing that compassion and showing that you care and you understand, their worries, and just assuring them that they're going to be okay. It can just, it's really important. So just keep that in mind. And I know you all out there have it, or you wouldn't be in this field. So just remember that that's really important. To not get frustrated with folks in times like these, because they're hearing a lot of things, and you're going to be the solid ground that they stand on, just to make sure that they know that everything's going to be okay. Being adaptive, which you all are in healthcare and home care alone, you have to be adaptive because things change all the time. But just consistently having an adaptive outlook and being able to change where changes need to be done, and to go along with the recommendations of the experts out there is real important. Trustworthy, the that's a big one across the board in home care. It's very important to us. We hope that you trust us, and we in turn really trust you all, to be consistent, and show up for work. And in times like these, that's really important, because these folks really depend on you guys. And a familiar face walking in that door can really be important for these folks. And patience. Patience is another one. It's a huge one. Like I said, we will get through this, okay? Together, we will get through this. But we all have to be patient. We have to be smart, we have to be safe, and it will work itself out, and it will get better. But those are just a couple of areas that I wanted to touch on briefly, and just put it out there that you all are, again, the front line, and you all possess these qualities. You're all very capable of handling this extra workload, and we appreciate you, and we know that you will do an excellent job for us and your clients. Now I'm going to get into a little more clinical. Again, our clinical director, Bev Francis, put these together, and these are just a little couple bullets just to go over to make sure that we're all on the same page going forward. And this is going to assist really everyone in kind of preventing the spread of this any further. The first one is, and this has probably been all over the news, but it's very important, and it is, if you are exhibiting any symptoms of, a respiratory infection, a cough, a sneeze, anything like that, you really, really shouldn't be around vulnerable folks. And the CDC, the federal experts on this are saying vulnerable folks are anybody ages 60 and above, 65 and above actually, or that have pre-existing issues with heart, diabetes, things of that nature. And because they have compromised immune systems, and they, let alone having this virus around, they're at risk, and they're even more at risk if they have some kind of respiratory infection going on. So we really, really want to try to keep anyone that's not feeling like 100%, away from those vulnerable adults. So just keep that in mind. And if you have any questions on that, if you have any questions on whether should I go, should I tell someone that maybe I ask somebody if they think I should go or not, I would suggest to call our clinical director, Bev Francis, and she'd be able to assist you with that decision and help you along. Bev is a wealth of knowledge, and she has been right there with us, monitoring the new information coming in from all the experts, and she would be your best go-to to be able to make that decision and make it wisely. Another big thing is when you go into the client's house or wherever they may be, just make sure that all the surfaces that are touched regularly, the TV remote, the telephone, the counters, just make sure that you clean those quite often during this outbreak. And that means use a disinfectant, soap and water, something like that, so that you kill those germs, and you try to keep that as clean as possible for these folks, because that's the key to preventing this thing from spreading even more, is to clean the surfaces that we all touch the most often, sinks, handles in the refrigerator. It's just stuff like that maybe you may not do on a very consistent basis, but during times like these, you're going to want to do it more and more often. So just keep that in mind, that when you're at our clients' houses, just clean all the surfaces for them. Another big one that I mentioned in the email that I sent out a few days back is during this outbreak, we're telling all of our caregivers to keep the client at home. That means that if the client has a mandatory doctor's appointment, or something that has to be done. Obviously, we want you to call Bev Francis first and make her aware so that she knows that the client will be leaving the house. Otherwise, the normal errands, going to the grocery store, going shopping, we are going to put a stop on those for right now, and we're going to limit that client from being around a wide variety of people, and we kind of want them to be in their house during this time to prevent them possibly getting anything while they're out in the public. So that's very important. If you have any questions on this, and if something comes up with an appointment that you need some counseling or you need help with, reach out to us and we can help you with that. Socializing, I would say if you're in a community, use good judgment. Okay. Again, we want, even though it's inside of a community, we're really pushing on staying inside that client's house and limiting the social aspect. That may be an issue for some people. However, you being the voice of reason can really talk to them and tell them how important it is to keep them safe and to limit the amount of people that they come in contact with on a daily basis. So, and if you have any issues or if you're having a hard time or the client's really giving you a lot of kickback on that, we can definitely step in and assist you with that conversation and possibly get the family involved. I know that a lot of communities around Maryland are starting to cut down on those social activities, and most of them already have, and if not, they're in the process of doing that. So that may not be that much of an issue in the near future. So a lot of the communities and the experts are saying to limit our clients being in the vulnerable realm of folks out there, limit their amount of visitors. And that's very important as well. That goes into the socialization, but that can be hard, and that can put you as the caregiver in a hard position. And I would say, in that case, lean on us for that, and we can talk to the family and reason with them, and be the buffer there between you and the family when it comes to limiting the visitors. Obviously, every situation is going to be different. So I would just say that's where patience comes involved and adaptability. And, we are there for you guys to help you make the right decision for our clients together. So at this time, we're going to go over some normal practices that you should follow on a daily basis when you go to work and for our client. First one, and probably the most important, is proper hand washing. So when I say proper hand washing, I'm talking 20 seconds or more. Soap and water, and you need to lather the entire hand. Now, the experts are requesting or are saying that the best way to prevent the spread is to wash your hands for 20 seconds or more every hour. I would say that if you're with a client, you should do that. So every hour while you're with the client, make sure you wash your hands for 20 seconds or more. There's some times when you may wash more times than that within the hour, and those would be if you remove your gloves. If you're helping the client, you have gloves on, you take the gloves off, immediately you want to wash your hands with soap and water. You need to avoid touching your face while you're with the client and at home, mainly the eyes, ears, mouth, and nose area. Also, spread the word to your client and let them know as well not to touch those areas, as those are ports of entry for any kind of germs and stuff like that. You also want to encourage your client to wash their hands regularly, and that may be something that's different for them. And work together and come up with a plan every time they go to the bathroom, or every time they eat, or every time they do any kind of thing that requires hand washing. You just want to help them with that and try to build that that foundation so that they will do that even when you're not there. When you are in a social situation with your client, you want to stay 6 feet or more away from anyone in particular, and that's coming from the experts. And I would suggest you adhere to that, and that would limit the chances of getting any kind of spread of the virus. And another one is going to be if you do laundry or you remove trash, just make sure that you wear gloves. And once you take the gloves off, obviously you're going to wash your hands. Again, all these things, if you have any questions at all, I encourage you to reach out to Bev Francis, our clinical director. She's there. She's available by phone, by email. And if you can't, you can always call one of us and we can relay a message to her. If you or your client develop any kind of symptom, a cough, sneeze, any kind of respiratory system, I want you to call Bev Francis immediately. And let her know, and she will advise you on the next step that you have to do. If you do cough and sneeze, whether you're with the client or not with the client, just remember to do it in a tissue or in your elbow, not in your hands, okay? We want to try to avoid any kind of coughing into our hands or sneezing into our hands, because we don't want to transfer anything. So again, in closing, that's a lot of information. Again, I would say contact us if you have any questions on any of these items. This is just a brief update on some of the things that we have heard is the best in preventing this from spreading. Again, we appreciate everything that you do. You are such a key cog to the prevention of this into our clients' homes, into your homes, and we know and we are very confident that each and every one of you are up to this task and are responsible and are really, really trustworthy, and we will get through this together. Thank you.